We wait 2-3 minutes and we make it immediately.
Yeah, we can do that now.
Because Kalvet out. Yes. European harm reduction. And this European or European? Eurasian. Okay. So I will say that a bit and then, but we make it all in English. Okay, we are here in the 17th CND Conference on Narcotic Drugs with Kalvet March, 60s, Kalvet March for European Asian Network for Harm Reduction, which is very important also because Estonia has lots of things that maybe is in between Finland, Scandinavia, but also Russia. And so we asked him about what is the situation of drugs in general. It seems to be also quite interesting that lots of people take fentanyl drugs that use in the United States, which is high prevalence of overdoses. It seems to be the highest in Europe. At the same time, there are anti-prohibitionist movements. There's a curious approach of the government. Yesterday we saw it's a quite social democratic minister, and lots of contradiction. So just explain in 5 minutes what's going on in Estonia, maybe.
As you already explained, everything is in flux. We are in the middle of great changes, I hope. As sort of, I don't know if it was ever intentional, but in the current context, Estonia definitely was sort of like a pilot project for a fentanyl market. For quite a while, we were pretty much the only country in the world that had no heroin problem, because all heroin was switched for fentanyl. There was something happened in the Middle East in the mid-2000s that made heroin. There was a drop in supply for quite a while, and during that lull, from somewhere, fentanyl flooded the market, and people started dying because nobody was accustomed. People weren't careful enough with the drug, and so since then we've had the biggest overdose mortality in Europe, but it has been falling a little bit. The days of the peak of the crisis are behind us, like 2 or 3 years, and there's debate between different agencies. The police and other enforcement agencies are sure that it's because in 2010, I think, they started really crushing down on street dealers. And it's easy to crush down on street dealers because in Estonia the drug laws do not specify amounts, but the criminal amount starts with enough substance to get 10 people high.
Okay.
Not one person's 10-day dose, yes. But just to get 10 people high. If you take fentanyl, you shoot it 4 or 5 times. If you're a hard user, maybe even 8 or 10 times a day. So your daily dose is the criminal amount.
Yes.
So it's easy to bust people, just your regular users who carry more than like 1 day's amount with them, to bust them as hard as possible. So the police think that the drop in overdose mortality is due to that. Yes. That there is a theory that because prices went higher after this crackdown, the product is more diluted.
Yes.
It's possible, we don't know. And on the other hand, we have the National Public Health Institute and Harm Reduction and Prevention Services, who believe that it's due to the beginning of the naloxone program also. Yes. Coincides with these efforts. So nobody really knows what's working. And that's also part of why I'm here with the Eurasian Harm Reduction Network, to start consolidating and implementing global drug policy assessment tools. Yes. The pilot project will start already this year in the Baltic region, Estonia, Latvia, Lithuania, And if that's successful, then we can implement it globally. I think that's
what is made of this project?
Come by on Friday morning, because I don't really know the details.
Okay, Friday morning.
Friday morning we have this side event presentation, and I and DCP will be there explaining, and Dasha Matyushin also from Eurasian Harm Reduction Network. They know more about the models and the methodology.
And are there some social movements for legalizing cannabis, for instance?
Yes, I'm also with the Estonian Medical Cannabis Union, and we have been active, I think, for 3 or 4 years, trying to push for patients' rights.
Yes.
But the situation is difficult because, of course, any homegrown or not classified as medicine herbal cannabis is out of the question. Sativex is too expensive.
Yes.
And we're trying to convince them right now that Bedrocan is the way to go.
Yeah.
But fortunately, we've already had one session with the Committee of Social Affairs of the Parliament, and they decided that we're probably not going to do it, but let's have another session. So we have another shot in April. We're looking now for doctors in Europe who could come as expert witnesses to speak to the Estonian Parliament and the Estonian doctors, because doctors are very reluctant. They don't want anything to do with it. They are very careful with it.
Okay.
But there is change.
That's good.
Thank you. I hope